Well, the study reported that people are reluctant to tell the truth or don't tell the truth because they're embarrassed, they're fearful of being judged. During over 35 years of patient care as a mental health provider myself, but in watching literally thousands of interactions between medical students, residents, physicians, and other healthcare providers, I see those issues come up all the time. Well, the two reasons that were the two most dominant reasons that the study revealed were patients didn't understand instructions, or they disagreed with the recommendations. We have strategies for dealing with both of those things. If patients are at risk of not understanding, we can do things like use teachback, a technique that's been shown to actually improve patient understanding. And there, it's a common communication method that we use, most of us, throughout life, and that is we ask people to say back to us what we think were the instructions that we shared. It's a really good idea for clinicians to be taught to ask, are there any barriers that you can think of to following through with this recommendation? Are there any concerns that you have, any risks? Those are especially important questions to ask if patients return and they haven't followed through on the recommendations. We are increasingly providing more training to clinicians in every field, especially in medicine. When physicians feel stuck or confused, one of the best remedies is to remember that they're part of a team. The lesson here is to be curious. We teach medical students to be curious about the belief systems of the patients that they see, to find out about the influences in their lives. I think being curious and remembering the importance of curiosity about patient experience, especially if patients are complex in their needs, can really go a long way towards making our clinicians have a more rewarding professional life and being more effective in promoting health outcomes.